Hello, it's that dental dude here, and today we're going to be going into the surgery and we're going to look at the basic set of instruments that I use every day for an examination for a patient. I'm going to tell you what they are, how they're used, and all that sort of information, just so that you get a better idea of what goes on when you come for your checkup next time. Let's get on with it. So in my examination kit, I've essentially got these 4 instruments. Yeah, and we'll talk about them in turn. Okay, so we'll take the first one is a mirror. Yeah, and I use a size 4 mirror for most of my practice, a small one. That does me fine. Next, we've got this baby. This is a right angle probe. Yeah, it's a sharp ended probe, and we'll go through that in a minute. Next, we have a scaler, and basically that's got a sharp sickle shape at either end, which allows the removal of tartar and other obstructions and things like that from in between the teeth. And then finally we have this, which is called a BPE probe, a basic periodontal examination probe, and more of that later. So I've got a massively oversized model mouth here in front of you, and I'm going to just show you what the mirror is for. Now, the mirror has got essentially 4 functions. Okay, so the first function that everybody's going to be familiar with is the fact that it reflects, where the dentist can't see directly. So at the moment, both you and I can't see behind this tooth here, and what the mirror does is it allows me a clear and unobstructed view of what's going on behind there. Okay. Second function of the mirror is that it will allow, as light hits the mirror, it will allow that pool of light to be reflected onto that surface, and thereby improve my view by providing, sort of bouncing the illumination into the right place. Okay. The third function of the mirror is retraction. So if I want to move the tongue out of the way here to see what's going on in this area, or move it out of the way from the bottom teeth to see what's going on there, I can use the back of the mirror to push those structures out of the way. And it's the same with the cheeks. You can put the mirror there and just pull gently and then relax it back. Okay. And the final function of the mirror is one of protection, so that if I was filling this tooth, for example, I can use the mirror down here and push the tongue out of the way while I'm working. Okay, or use it the other way, just there, and ease the tongue back. And that means the handpiece, i.e. the drill that's going to be taking away all the decay and stuff, can be whizzing away, taking all that decay away, and it won't touch, it'll touch the mirror first and not the soft tissues, which is really important, because you want to limit the risk to damaging these soft tissues. It's this you want to be concentrating on. Let's move on. So the way the mirror is used is it's used in the non-dominant hand. So I'm right-handed, so the mirror sits thusly in the left hand when I'm working, and then I can use that to maneuver and do everything that I just said. And then the dominant hand has whatever instrument you're going to use in it, and most of the time you hold it like a pencil, and that gives you the fine motor control over that particular instrument. Now this particular one is called a right angle probe. So if we look, can we see that? It is basically a pin on the stick. Okay, and the purpose of this pin on the stick is to check around the margins of any fillings or crowns and things like that. So if this tooth had a filling here, yeah, I could gently probe that filling, check if it's leaking or if it's debonded or rocking. Yeah, you can gently probe the teeth as well for any soft spots, but obviously not too far, and just generally investigate any restoration or pathology that's on the tooth. Yeah. Also, it gives you a bit of tactile feedback, so you can tell what material it is just by running it along the surface. So glass ionomer, for example, feels a lot rougher than composite does, and you can check gently for the margins for things like tartar, calculus as we call it, just around there. Okay, so the right angle probe, everybody. Next, we have what's called the BPE probe, and this differs from the right angle probe because A, this part is a lot longer, and B, it's got a little tiny ball at the end, and C, it's got these black markings on there. And what's that used for? Well, in principle, it's just used for doing a basic periodontal examination, or BPE, which everybody should have every time they have an examination done. And essentially, it's a simple ruler. And we'll talk about BPE in a separate video and what that means. But essentially, the BPE probe, the little ball, goes around the pockets of gum, around and between the teeth, like so. And what you check for is for any bleeding on probing, and whether or not the pockets have got any depth to them. So in healthy teeth, healthy gums, you shouldn't get any bleeding, and the pocket depth shouldn't be further than that black band. Okay, the first part of the black band. So you go round, and there's no bleeding on this, obviously, because it's made of plastic. And you can check behind as well with that, and you do that on all the teeth all the way around. Yeah. And so let's reach for the final thing in my armamentarium, and it's this little instrument here, and it's called a sickle scaler. Okay, and the way this works, it's shaped like a sickle, like you'd use for cutting crops or whatever, and it's got a pointy end, and it's got a sharpened edge, and it just goes in behind the teeth, yeah, where the tartar is, and you lift it up gently and you scrape off any tartar there. Now, if a patient comes to see me just for an examination and they have some light deposits, I'll just take a minute, with their permission of course, just to relieve them of those deposits and not do a separate hygiene appointment. Yeah. Obviously, if the deposits are more substantial, then I have to reach for some more sophisticated kit to get that tartar off. And there are groups of patients, of course, that have got really sensitive teeth as well. So the ultrasonic scaler, which we'll go through in another video, isn't really suitable for them because it's really cold, and they prefer tartar removal with this or something like it. Yeah, just goes in between the teeth and scrapes off all the tartar. Yeah, just like that. Okay, and there we have it. That's my basic set of instruments for an examination. Now, I'm going to do a separate video on how I do an examination for real. Yeah, but it's a good idea to get a heads up about how these instruments actually work before we actually make that video, and then you've got a better idea of what's going on, won't you? And that's it. Stay tuned for another video on the instruments I use for basic treatment, which is going to come up in the next few weeks. Bye for now.